There is no silver bullet at the moment, and there might never be.
A stark assessment from the World Health Organization as the world races for a vaccine for the coronavirus.
A number of vaccines are now in phase 3 clinical trials, and we all hope to have a number of effective vaccines that can help prevent people from infection.
Stage 3 trials, typically the final stage, after which the vaccine could be cleared for widespread use. 2 by the companies Moderna and Pfizer now being tested in thousands of people across the U.S.
Dr. Fauci, are you concerned about...
A top expert saying hopes for a vaccine by the end of 2020 are strong.
We're cautiously optimistic that we will have a vaccine available. That means that as we get into the end of the year and 2021, that we'll start to see doses available.
But the Global Health Agency is warning against complacency, saying people and governments should do it all.
For now, stopping outbreaks comes down to the basics of public health and disease control: testing, isolating and treating patients, and tracing and quarantining their contacts.
According to the global tally by Johns Hopkins University, more than 18 million people have been infected and nearly 700,000 have died. The WHO says the fatality rate is hovering somewhere below 1%.
That may not sound like a lot, but it is quite high if you think about a virus that can transmit readily.
When it comes to turning the tide on this pandemic in the most infected countries like Brazil and India, it will take time.
It would seem to me that in most countries that have experienced intense community transmission, the way out is long and it requires a sustained commitment.
The U.S. remains the country hardest hit by COVID. It's reporting around 60,000 new cases and 1,000 new deaths every day. Numbers critics say show Washington's pandemic response is failing.
It's not our job to tell the U.S. what it should be doing.
But the message from the WHO remains clear. With no silver bullet to end the crisis,
thank you very much, everybody. Thank you.
Leaders must listen to the science.
Sometimes we know the right path. The difficulty is choosing to walk it.
For City News, I'm Caryn Ceolin.